Hello and welcome to Anatomical Terminology with Trish. Have you been struggling with terminology, cramming for a test, or just trying to review? Don't worry, because you've come to the right place. Alrighty, first things first. Why on earth do you need to know this? We study anatomical terminology so we can easily pinpoint specific areas of the body. This way, we spend less time trying to decipher vague descriptions and more time moving forward. As we discuss anatomical terminology, we use the standard anatomical position as a reference point. You'll notice that our reference is standing upright with the head, palms, and feet facing forward. Notice that our reference still maintains anatomical position even when facing the side. However, for the purposes of this lesson, we're going to go ahead and zoom into that brain. There are many different ways to take a better look at the brain. The three standard planes include the horizontal, sagittal, and coronal planes. The horizontal plane divides the brain into the top and bottom half. The sagittal plane divides the brain into the left and right half. And the coronal plane divides the brain into the front and back half. We're going to go ahead and start off with the sagittal cut. Starting off with some new terminology, we have superior, meaning toward the top, and inferior, meaning toward the bottom. To remember superior being up, I like to envision a superhero flying upwards. Moving forward, we also have anterior, meaning toward the nose, and posterior, meaning toward the back. The following terms are relative to the axis of the central nervous system, so make sure you pay close attention. In relation to the brain, we have the dorsal and the ventral directions. Dorsal relates to the top of the brain, while ventral relates toward the bottom of the brain. Still in line with the sagittal cut of the brain, we have rostral and caudal directions. Rostral refers to the front of the brain, and caudal refers to the back of the brain. Okay, stick with me as we talk about how these terms apply to the axis of the spinal cord as well as the brain. Let's revisit these terms in reference to the spinal cord axis. On this new axis, ventral actually means the front of the spinal cord, while dorsal means the back of the spinal cord. I think it's easiest to remember dorsal as the top or back, as it also relates to the dorsal fin of a dolphin. Again, we have rostral and caudal. In reference to the spinal cord axis, rostral means the top of the spinal cord, and caudal means the bottom of the spinal cord. I know that these words can take a lot of getting used to, so feel free to go ahead and skip a couple seconds back just to review the same material. Moving on to a dorsal view of the brain, or a view from the top of the brain, you can see the rostral and caudal directions, as well as the anterior and posterior directions. And now introducing the terms medial and lateral. Medial refers to the middle, and lateral refers to the edge. The same terms apply when viewing a coronal plane. We can also use a coronal plane to identify the terms deep and superficial. While superficial means closer to the surface, deep means further away from the surface. Let's zoom out. You'll notice that the terms medial and lateral, as well as deep and superficial, also apply to the full body. And again, in review, you can see that superior and inferior, as well as anterior and posterior, also apply. Building off, we can introduce proximal and distal. If the purple dots highlight the trunk, proximal refers to toward the trunk, while distal refers to being away from the trunk. We can also introduce the terms ipsilateral and contralateral. Ipsilateral refers to items being on the same side of the body or impacting the same side of the body, while contralateral means the opposite side of the body. Thank you so much for watching, and I hope this helps.